the ESGE, has recently published its performance measures for colonoscopy in inflammatory bowel disease patients. The authors of this work are the big names in inflammatory bowel disease endoscopy from across Europe. I'll run through some of the key recommendations that are specific to inflammatory bowel disease endoscopy. But of course, I encourage you to look at the paper yourself, and you can do that by accessing it on the GastroLearning platform. So, firstly, they talk about the importance of photo documentation and suggest that in inflammatory bowel disease colonoscopy, each segment of the bowel that is inspected is photographed. Therefore, they recommend photos to be taken of the ileum, cecum, ascending, transverse, descending and sigmoid colon and the rectum. Additionally, they recommend that photos should be taken of any lesions that are seen. The working group also suggests that all colonoscopies in patients who are suspected to have inflammatory bowel disease should reach the terminal ileum. And where IBD is suspected in colonoscopy, patients should have 2 biopsies from each area of the bowel, whether that area is macroscopically normal or is affected. So those are the areas we just mentioned earlier about photo documentation. They also recommend that biopsies from the terminal ileum are placed in a separate pot than those from the colon. In patients where a diagnosis of microscopic colitis is suspected and therefore requires biopsies in entirely normal colons, they suggest that biopsies are taken in the left colon and 2 biopsies are taken in the right colon and placed in different pots labelled accordingly. These guidelines also suggest that endoscopic activity score is used in patients to assess disease activity in those with ulcerative colitis. They acknowledge in these guidelines that there are a large number of endoscopic scores, and they suggest that the Mayo endoscopic score and the ulcerative colitis endoscopic index of severity scores are those that are most commonly used, and therefore suggest that they should be used in your practice. They suggest that the Mayo endoscopic score is the easier to use and thus perhaps is the endoscopic score of choice. Activity scores in Crohn's disease are more complex, and as such the working group agreed not to include these scores in their recommendations. However, they did suggest that where feasible, an endoscopic score for Crohn's disease should be used, and again they suggest here the simple endoscopic score for Crohn's disease. Like in all areas of endoscopy, the use of high definition and image enhancement endoscopy is recommended, and these guidelines also suggest that we use virtual or dye-based chromoendoscopy. They suggest that dye-based or virtual chromoendoscopy in combination with targeted biopsies should be used in patients undergoing surveillance in IBD. And in these patients who have had long-term IBD and are undergoing regular surveillance endoscopies, they suggest that a neoplastic lesion should be detected in more than 8%. That's our detection rate for neoplastic lesions should be above 8%. Now, I think these are important guidelines to ensure that quality endoscopy is occurring in this high-risk groups of individuals. I would strongly recommend that you watch the GastroLearning live show we did a few months back with Mark Saman, where we discuss these endoscopic scores we mentioned earlier, along with a multitude of other things to do with inflammatory bowel disease endoscopy. So click on the link and enjoy.